Did you know that 1 in every 20 American suffers from some sort of mental health disorder, including major depressive disorder, bipolar disorder, and a vast variety of other mental health conditions? Also, the idea and concept of love and being in loving relationships or loving others has been shown to decrease the number of suicides in children and adults. What is going on, everyone? This is your daily dose of mental health with Adam, and in this video today we're going to be discussing a variety of myths you shouldn't believe about staying in a mental hospital. So essentially what we'll be discussing in regards to that is common myths you've probably heard or you think of when you see on TV in regards to what a psychiatric or mental health hospital is like. But we're going to break down the stigma of it and I'm going to give you experience on what it's really like. I'm a psychiatric RN and I work in the psychiatric inpatient field. So we're going to jump right on into it. Please like and subscribe to the channel. I greatly appreciate it. And leave a comment. And if there's anything you want me to cover, leave me a comment, drop me a comment, and I'll get back to you on it. Let's jump right on into it. All right, so myth number one that I think, and I've heard others say in regards to staying in an inpatient psychiatric setting is everyone at the psychiatric setting essentially is in the loony bin and is like a drooling zombie. That is a myth, and the reality of that is, I'll be real honest, people will assume that to being like, oh my gosh, when I was there, it was like The Walking Dead. Everyone had booty juice, shots, Thorazine, the Thorazine shuffle. I mean, I've heard, that's one thing that I've actually, one of my cousins who doesn't know anything about the inpatient setting, he's said a comment like that. He's asked me what it's like to work in one. And he's like, yeah, I know somebody who has been in a psychiatric setting before. And he said it's just like, just everyone zombied out. So that is a myth. In reality, the patients have milieu time and they see therapists. A lot of times they get to play games. And I'll be real honest, working on a variety of different floors, including high acuity, shots aren't just handed out. Shots are given to patients in particular situations, like if they're involuntary, and it's by a state-by-state basis because they are refusing medication and they're considered a danger to themselves. That's the only time that's a lot of times when medications are given, or depending on the aggressiveness of the patient towards others, that's when shots are given. So no, that's not something. So this is the furthest from the truth. That a patient is in the loony bin. So that's myth number one. Myth number two, mental patients are all violent and dangerous. In reality, people with severe mental illnesses are no more likely to be violent than any other person. And a lot of times, they're more than 10 times as likely to be a victim of a violent crime than the general population. So that's true. So in my opinion as well, when we talk about this, depending on the unit you're on, there's higher acuity units. There can be more aggressive patients. I'm not going to go out and say violent unless they have a history of it. But the real thing is the overall idea that they're all violent, that is not true. Some people can be violent. Some people can also be high on things like PCP, where that is what's causing it, and they're sent too early to the psych facility when they should at first be in the ER. That can happen. And a lot of them do go through trauma, but at the end of the day, they're not all violent. So that is myth number two. But I'll go more into this subject a little later in a further video. Okay. Myth number three, another myth I've heard commonly is staff will force pills down your throat. That is not true. Me as a nurse, I can never just force a patient to take a medication. If they're voluntary, or even if they're involuntary sometimes, you can't just force someone a medication. That does not happen. There are situations where if a patient's involuntary, it can happen, but that's specific situations, like if it's a court order. But outside of that, no, you're not going to be forced meds. Though doctors will recommend meds possibly, but they're not. But if you don't want to take it, they will not force it. That's why there's other therapy there. You see, you're in the milieu. You do you work with a therapist. You go to psychotherapy and different types of therapies, and they're not just going to be They're not just going to be force feeding you pills. If you don't want it, if you don't want medication and you're voluntary and you believe there's a better route for you to go, that can happen. There's no problem with that. But if there are, so that is another myth. We don't just jam pills down people's throats. All right, myth number 4. This one I wanted to cover briefly because at a hospital I did work at, ECT was one of the procedures they had at that psych hospital, because ECT isn't at all inpatient hospitals. And the myth is ECT is a scary and violent punishment. That is not true. Typically, ECT isn't even an option for a treatment unless you've shown that you have that you've tried medications and they have not worked for you at all. You've had no success. You haven't tried other strategies. For example, you haven't tried exercising and other activities that could potentially help with depression. It's it's more so not a last resort, but it's a resort that's down the line that is not first off forced on anyone, and it's not a violent punishment. It just depends. It's a circumstantial thing. But I will say, people who have gotten it, I know somebody who got it as well. ECT, there are risks obviously to it, but in reality though, I've seen people who have actually had a great experience. And also, yes, I know one thing people will think is, oh, you can have seizures after it. You can, but I've just seen how incredibly helpful it can be. I'll just say this, there's a quote by somebody I found online who really thought it was useful, and her quote was, "ECT has been a lifesaver for me so far. I am able to function and hold down a part-time job. I recommend trying ECT if depression and sadness are overwhelmingly and too complicated." So there you go. Yes, it's a myth. Are there risk factors associated with it? Yes, but most things have risk factors. Medications you can have side effects. So that is a myth. It is not all violent and scary. I've seen people who it's helped a lot. Myth number 5. All hospitals are the same, and all mental health hospitals are the same, and they keep you locked inside without access to fresh air. Another lie. In reality, for example, I'll just say this: at both places I've worked in the psych field, they have access. There's specific designated times on their schedules where they get to go outside. In fact, one of the psych hospitals I work at, smoking is still allowed. So they'll have all the units will have at least 4 outdoor breaks where they can smoke out there. So you're not just locked inside. Now are there times when we have to, if like a patient is an elopement risk, we can't let a specific patient go outside to the courtyard? Yes, especially if patients are elopement risk, that can be. So if you notice the trend with a lot of these myths, is it's like the myth is either it's like an all or nothing. The thing they're saying, like with the myths they're saying, are there situations where X can occur? That's true, but it's not for everyone. They get smoking breaks. They get, actually, another thing, if they're not an elopement risk, they get to leave the unit and go to the cafeteria. They can have water bottles on the unit, and it's not like we do have patients who come from jail, and I specifically ask them, was jail, because I'm like, a lot of patients will say that, oh, psych wards are just like jail. The ones that come over to where I work, they would much rather be in the psych facility because, once again, you get to smoke and you have a lot more independence in this facility. Now, depending on the unit, sometimes can be a little different, but all in all, independence is huge. So that myth about all hospitals being the same and they keep you locked inside without access to fresh air is not true. Is a myth and not true at all in any way. And finally, myth number 6, you're stripped of your gadgets, meaning your phone, everything, and denied contact with the outside world. Now, the reality of this is, you're stripped of your gadgets. Okay, what do you define as a gadget? What if they have a sharp object on them? What if they have a knife? What if they have something that can hurt them and they're in the psych hospital for something like major depressive disorder and they're suicidal? And you're going to let that patient have, for example, not even their, anything in their room? Are you going to let them have strings? Are you going to let them have, really gadgets can be defined as a lot of different things. In reality, at the psych hospitals I've worked at, they've had, outside of the crisis we're hopefully almost out of, they had visitation hours at the hospitals in the afternoon where you could have up to two friends come up and come speak to you and talk to you for like 30 minutes to an hour. It was called visitation every day. And there's typically a time set away where if you have to use your phone, they will let you have access to it as long as you stay near the nursing station. And we know essentially that it's being used in a productive way. That's the big thing. You're not denied them. Now, once again, if, let's say you've had access to your cell phone and you're calling 911, or you're not using it to be beneficial towards you, you're not going to groups, all you want to do is be on your phone, then we might make a restriction. Or if you've been violent with, if let's say for example, we won't let you use your cell phone. Let's say you've used a staff phone and you broke a staff phone. We're not going to let you use it. That's just a for sure as well, because when that happens, if you're breaking things in a psych facility as a patient, we have to take that very serious, because if we let you a lot of times use your cell phone, and keep in mind, if you're in active psychosis or, something else, we don't want you destroying your own valuables. And also, photos are a big concern, and of taking photos are a big concern. So if you're caught doing anything like that, your phone would be taken away, because that is a big problem. If a patient leaves a psych facility and they take in photos of it and that gets leaked onto like Facebook or some sort of outlet, the hospital's going to get in a lot of trouble, especially if it breaks HIPAA violations where there's patient information or another patient themselves in that photo or video. It leads to lawsuits. So once again, you are not stripped of all your gadgets. Depending on what you're there for, depending on your behavior, you can use your gadgets, and you're not denied. You're not denied to seeing family members. There's visitation. So that's another one. And also, real quick, I was going to let everyone know that after I'm done with this myth series, or this myth video, I'm going to be doing a series in regards to what it's like to work on the 3 different floors of a psych hospital. So one is going to be the detox unit, another one's going to be high acuity, so psychosis, schizophrenia, aggressive patients. That's going to be another video. And the third video we'll be discussing one in regards to a unit that's really like major depressive disorder, borderline personality disorder, and what it's like to work on these units, and things that you should know if you're planning on going into it. But I hope you like this first series this first video I just wanted to drop. It's kind of like the intro into the psych series we're going to be doing. So I hope you enjoyed the 6 myths I just went over with you, and please like and subscribe to the channel. I'm going to be doing a video a week at least, and I hope you enjoy it. Love you all. Put a comment. And in the future, I'm going to be going live. So I'm going to do one randomly. I'll let everyone know in advance. But yeah, hit that like button. I love you all. And please, please, let's reduce the stigma, help others, and just be better people. Open the door for somebody tomorrow. To make somebody's day in that way, just let's be good people. That's another big core value of this channel, is to strive to be better to others. All right, I love you all. catch me out for the next video on what it's like to work on the high acuity unit at a psychiatric hospital.